We are here with Dr. Hoogenraad, a promoter of zinc therapy. The world first introduced zinc therapy for Wilson's disease as an effective choice in 1978 by publishing an article in the Lancet. What are the different hypotheses on Wilson's disease, more or less? Could you explain it?
Yes. At the time of penicillamine, when that was thought to be a good treatment for Wilson's disease, at that time it was thought that Wilson's disease is caused by copper accumulation. Mm-hmm. And it was thought that drugs that increase the excretion of copper, that those drugs would be effective treatment, but there had been no studies to see if there were good arguments to choose penicillamine for treatment. And Schouwing, he did a study and he found that it is much more rational. He was a critical rationalist. Mm-hmm. Schouwing, it's much more rational to give a drug that does lead to a decrease of copper excretion in the urine. Copper excretion in the urine is increased in Wilson's disease, and treatment should aim at decrease of that symptom. Mm-hmm. And penicillamine does the other way around. If you give it a tablet of penicillamine, it will lead to an increase.
The same as what the disease does.
What the disease does. It's not rational, it's irrational treatment.
And also dangerous.
It's very dangerous.
So you found the basis of copper intoxication more powerful. What would be the origin and basis of bad science in Wilson's disease?
That's very important to realize, that Wilson's disease is not caused by copper accumulation, but by insufficient incorporation of copper.
Yes.
And that results in the situation that free copper in the blood is not detoxificated. And free copper is very dangerous.
Yes.
It can pass the blood-brain barrier.
Yes.
So if you have too much free copper in the blood, you can get intoxication of the brain. Yes.
Yeah, and this is the reason that many patients deteriorate on penicillamine and trientine.
That those patients became in great dismay. And that was called the paradoxical reaction. It was called paradoxical because good excretion in the urine, and nevertheless worse. And these patients can become very worse, and it can end in death. Death that is not needed if you give no penicillamine, but if you give zinc, then it can change the whole situation very quickly. Yeah. But you have had experience.
Yes.
How that can tell about.
Okay. And you are a retired neurologist of Utrecht University, but you are also very interested in liver transplantation, and I can say why. Recently, 1 year ago, we had a patient, a 10-year-old girl, who was referred to hospital by an acute liver failure and also hemolytic anemia and generalized jaundice, which is said to be the most severe form of Wilson's disease. And usually and actually, I can say almost always, the patients are expected to die even in few months or even few days. And according to protocol of Wilson's disease, such patients was in an urgent need of receiving a liver, and also prior to that they are advised to receive chelators like penicillamine to decopper the patient. And when the patient was diagnosed with Wilson's disease, I was informed to follow her treatment, and according to what I've learned from you and what I've found in your publications and your book, I was certain that penicillamine would not work, just maybe it would devastate the situation. I omitted penicillamine at the first stage and start zinc monotherapy as you always did. And the patient unbelievably very fast improved in 10 days, and a patient that should have died was discharged from the hospital just by 10 days zinc monotherapy.
Incredible.
Yes.
It was seen as a miracle.
Yes. Yes, you're right.
And I say always, that's not a miracle.
Yes.
That is evidence-based medicine.
Yeah.
That is taking the right decision, patient-oriented decision.
Yeah, and such a patient, if she has received a liver by liver transplantation, it would ruin her life.
Yeah.
She should take immunosuppressive treatment after liver transplantation, apart from the unbelievable cost of the treatment that would be more than $50,000 for a liver transplantation. The family should pay almost $300 every month to save that liver for her, and there are many complications after that and many side effects. Yeah, that is marvelous.
And your treatment cost of your...
Yeah, the cost of zinc therapy was less than $5. So, and even the zinc therapy for that period was less than $1, just $1. So $1 saved a life and saved a liver, inconvenient, dangerous liver transplantation.
Can you explain how you think that occurs? Why is that?
Yeah, as you said, this is just a result of evidence-based clinical decision-making and critical thinking, rational thinking, I can say. I learned these issues from you, and I'm always thankful for all I've learned, and I won't forget it. And I try my best to teach others how to think as I've learned from you, and I'm always in need of learning more. But it took me, more than a year to understand it, but it should be learned to any physician, and they should take it as a rule.
We talked about these questions at a conference.
Yes.
We are now in, and we found that this issue is in persons who work with liver transplantation in Wilson's disease is a very important, difficult problem.
Yes.
And they like to talk with us about these.
Yeah.
And
so
I hope we can go on with our cooperation.
Yes, of course. So you are here in Tehran because of Congress, gastroenterology and liver hepatology Congress, international one. So you were here to introduce the new way of thinking, a new approach and evidence-based approach in Wilson's disease. Thank you very much indeed, and I hope that this would help the patients and physicians to rethink about Wilson's disease and somehow.
Very important.
Yeah.
Yes.
Thank you very much indeed.
It was nice to be here. Thank you very much.
You're welcome. Thank you.